everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us. So, today we are here for an insightful session on the topic Midlife Reimagined, a 360 approach to wellness and renewal, organized by Voice of Healthcare in association with INTAS in issue of public awareness. So, in India, approximately 60 million women are currently navigating towards menopause, with the average onset around 47 years. Common symptoms include hot flushes, night sweats, mood swings, and vaginal dryness, which can severely impact the daily life and the mental well being. Despite the significant prevalence of these issues, awareness and education about menopause are often minimal, leading to widespread misconception and the stigma. Access to appropriate healthcare resources is particularly limited in the rural areas, which makes it challenging for the women to effectively manage their symptoms. Furthermore, HRT is underutilized even though it can provide substantial relief. Cultural perceptions surrounding aging and the menopause often discourage the open discussion, emphasizing the urgent need for comprehensive education and improved healthcare services to support the women during this critical transition. And in the light of these stats and facts, the aim of this session is to break the taboo around the menopause by raising awareness of its signs, symptoms, and the health risk. We'll address common myths, discussing coping strategies for mental and physical challenges, and also promote open dialogue to dismantle the stigma related to the menopause. Additionally, we'll also highlight the policy advocacy and the support groups, fostering a supportive community for women navigating this transition. So let's begin with the discussion. I would like you all to please join me in welcoming our experts who are going to provide us with insightful information on understanding about the menopause from A to Z. I would like to welcome Dr. Ashish, Associate Professor, Department of Obs, Vivekanand Institute of Medical Sciences, and Ramakrishna Mission Seva Pratishthan, Kolkata. Good evening, Doctor. Welcome to the discussion.
Hello, good evening.
Moving ahead, I would like to welcome Dr. Lilavati Guru, MD, Consultant, Gynae and Ops, WHO Fellow, Assisted Reproductive Technique and Infertility. Good evening, Doctor. Welcome to the discussion. Moving ahead, I would like to welcome Dr. Beauty Banerjee, Consultant Surgeon and Gynaecologist. Good evening, Doctor. Welcome to the discussion. Moving ahead, I would like to welcome Dr. Soumya Sinha, Director, Bela Initis Fertility IVF Laparoscopy Center, Chairperson, Minimal Invasive and Major Surgery Committee, Gynae and Op Society. Good evening, Doctor. Welcome to the discussion. So let's delve into the discussion points. To begin with the discussion about the understanding of menopause, I request Dr. Ashish to please provide us with the definition and describe menopause both in the medical terms and in the everyday language, and what are the key signs and symptoms that women should look out for.
While defining menopause, hello, is there any noise?
It is
Yes, please
echoing.
continue.
Just a minute.
Dr. Ashish, can you hear me?
Yeah, I can hear you. Is there any problem now? Can you hear me?
No. Yes, please. Yes. Please
It's
continue.
clear now?
Yes.
Hello? Okay. Uh, while defining menopause, we know there is a complete cessation of menstruation, which is caused by the failure of the ovarian follicles. Now, World Health Organization is in 1994 has said that this is a retrospective diagnosis. That is, 1 year there is no menstruation, then only we can say that the menopause has established. That is the medical terminology. Now, for the common people, it is perceived as the cessation of menstruation, of course, and along with that, it is the end of the reproductive life. Now, if you look at the sign and symptom, what a woman should look into, the cessation of menstruation is, of course, is there, but there is a spectrum of other signs and symptoms which follows maybe before or maybe after the actual cessation of menstruation. So if we look at them, we know that there is very common is hot flush, and there is sudden sweating, and which starts on the face, neck, and on the chest. And then there is dryness of vagina. Then there is dysuria. So all these symptoms, and of course the menstrual irregularity also. It doesn't cease all of a sudden. Like a menarche, the menopause also comes gradually, and there is excess bleeding to start with. Then the cycles are delayed, and then eventually there is cessation of menstruation. Now, all these sequences also may differ from people to people. So, in short, these are all the symptoms women should look, and they should, take help accordingly. Yes, Shubham.
Thank you, Dr. Ashish, for providing us with these insights. In following up of that, can you please also tell us, like, what age do women typically start noticing these changes related to menopause, and how can they best prepare for this transition?
As you have already told that in India the age is 47. In Western countries it is slightly late, is around 51. So they should seek medical help, and they should, of course, if for educated women it is easier. They can go to log on to internet nowadays. That there is vast knowledge is there, but only thing they have to be selective, because internet is not a censored place. So there are a lot of things available, but one is to know where to go and how to move about it. So when they have the problem, they should approach the right person, and the gynecologist would be the right person to approach, who will guide them accordingly.
Thank you, Dr. Ashish, for providing us with these insights. Moving ahead with the discussion to Dr. Lilavati, can you please tell us what are the most common symptoms of menopause and how do healthcare providers typically diagnose this stage?
The symptoms varies from person to person, and periods become irregular before it ends. And the common symptoms include hot flashes, night sweats, mood swings, vaginal dryness, and sleep disturbances. Also, there is change in libido. Women may also experience weight gain, thinning of hair, and skin dryness, trouble finding words and remembering them, called brain fog. There may be urinary symptoms such as stress incontinence and urge incontinence. And vaginal dryness leading to painful coitus. And this is menopause is usually self-diagnosable. So the healthcare providers typically diagnose menopause based on a woman's symptom and medical history. Especially if she is around typical age range of 45 to 55 years and has irregular or absent periods. They may confirm the diagnosis through blood test like serum FSH and estrogen. So particularly the high level of serum FSH and low estrogen are the common indicator of menopause. Other tests may include checking of thyroid function test, because sometimes hypothyroidism mimics symptoms of menopause, and in some cases also healthcare providers may also conduct bone density scan to assess the risk of osteoporosis, which can increase after menopause. A regular checkup and discussion about symptoms are the key to early diagnosis and managing this life stage. Thank you.
Thank you, Dr. Lilavati, for providing us with these insights on diagnosis at these stages. Moving ahead with the discussion to Dr. Beauty Banerjee, can you please provide us with the insights on in what ways does menopause affect the women's overall health and which health checkup should women prioritize during this time?
Of course. Effect of menopause on overall health. First is you all know that it is the vasomotor symptoms, which is the commonest. The most common immediate effects are vasomotor symptoms such as hot flashes and night sweats, affecting up to 75% of the menopausal women. These symptoms result from the fluctuating and eventually decline of estrogen level, affecting the hypothalamus, the brain's temperature regulating center. Then there is the bone health. Estrogen plays a vital role in bone metabolism. The decrease during menopause accelerates bone resorption over bone formation, leading to the rapid decrease in bone density. This makes menopausal women particularly susceptible to osteoporosis, increasing the risk of fractures, particularly in the spine, hip, and wrist. And the third will is definitely the cardiovascular health. Before menopause, women generally have a lower risk of cardiovascular disease compared to men, partly due to the protective effect of estrogen. Premenopausal, the risk, postmenopause, the risk increases with changes in lipid profile, increased blood pressure, and greater arterial stiffness. And now there comes another changes, the metabolic changes. Metabolic rates may decrease, contributing to weight gain, changes in the body fat distribution with an increase in the central adiposity, elevate the risk of metabolic syndrome, type 2 diabetes, and cardiovascular disease. The fifth one I want to mention is actually very important role is a mental health. Mood swings, anxiety, depression can occur or worsen at menopause due to the hormonal changes. It is crucial to consider psychological support and, if necessary, therapy or a psychiatric consultation. Urogenital health. Lower estrogen level can cause atrophy of the urogenital tissue, leading to symptoms like vaginal dryness, dyspareunia, increased urgency, and frequency of urination. These issues can significantly impact sexual health and quality of life. Also, coming to the skin and hair, reduced estrogen can lead to thinning of the skin, decreased elasticity, and slow wound healing. Hair may also become thin or become more brittle. And then comes the cognitive changes. Many women report issues like memory lapses or difficulties with concentration, sometimes referred to as menopausal brain. While these are the other temporary, it can be very distressing. Health checkup to prioritize. First and foremost is the BMD, bone mineral density test. We do the DEXA scan. All of you know about the DEXA scan nowadays. Given the increased risk of osteoporosis, it is recommended that women undergo a bone density test at the onset of menopause to assess fractures and monitor bone health over time. This helps guide decision regarding calcium and vitamin D supplementation or the need for osteoporosis medication. Next comes the cardiovascular screening. Regular monitoring of blood pressure, lipid profile, cholesterol, blood glucose level is advisable to manage increased cardiovascular risk. Lifestyle interventions such as diet and exercise are first line preventive strategies, potentially supplemented by pharmacotherapy. And then the one important thing again is the breast health. Before breast health, first and foremost, we should do a self-help breast examination. Then an examination by a specialist or expert, and then comes the mammography. Mammography is recommended biannually or annually for women over 50 years of age, depending on the risk factors of the women. Either they are BRCA positive or they have a strong family history, then we do more frequently. And if they are not, we can do it once in 2 years. Pelvic examination or pap smear. All of us know that what is the importance of a simple pelvic examination. While guidelines vary, continuing regular pelvic examination and pap smears is advisable to screen for cervical cancer and other gynecological conditions. Discussions about vaginal atrophy symptoms and potential treatment, including vaginal estrogen, are pertinent during this examination. You should talk with the patient. Then comes the colorectal cancer screening, though not very common in our part of the country. We don't do regularly, but this is one thing that if we get any symptom, any history, family history, or a simple history of alternative loose motions and constipation, then we should go for the colorectal examination, colposcopy and things. Then comes the thyroid function test. Symptoms of hypothyroidism can mimic menopausal symptoms. and depression and everything. So a simple TSH can do the thing. Next is the psychological health evaluation. Mental health screening or assessment for anxiety, depression, and cognitive function may be beneficial. How we will um, diagnose this anxiety or depression? So anything which is a bit too much for the thing, more worry, more aloofness, more depressed, more sad, anything it is, you out of proportion, if there is anything, you should, that should ring the bell. Now, lifestyle and diet consultation. Nutritional assessment can help manage weight and blood intake rich in calcium, vitamin D, and omega 3 fatty acid to maintain bone and heart disease. Exercise recommendation focusing on weight bearing, strength training, and cardiovascular fitness are essential component or overall health management during menopause. I must emphasize that it is definitely, you can start anytime, but this uh, weight training and resistance exercises should be started as early as possible in adolescent or the teen age. Okay, then comes a dental checkup. Check up your teeth, your gums. These are all the things. In conclusion, menopause represents a critical window for addressing various health concerns through comprehensive preventive healthcare strategies. Women should engage in open discussion. That is the most important thing, I feel. Thank you.
Thank you, Dr. Banerjee, for providing us with the various health checkups. And I think this is going to be really valuable for the women out there who are in this transition. Moving ahead with the discussion to Dr. Soumya, can you please explain about the hormonal changes that occur during menopause and how they relate to the various symptoms that women may experience during this transition? Dr. Soumya, can you please unmute your mic?
So during menopause and the period just before menopause, which is called as perimenopause, there is a deficiency of estrogen as the follicles from the ovaries become very less. There is less secretion of estrogen hormones, and so there is irregular period as well as those organs of the body where estrogen receptors are present. They develop symptoms of menopause, like these tissue which contains estrogen receptor are ovary, endometrium, vaginal lining, urethra, and hypothalamus and skin. So that's why we get these symptoms of menopause from skin, and depending on how long is the deficiency is, so these symptoms are divided into acute symptom of menopause, intermediate symptom, and long term symptoms of menopause. So if the deficiency is for 1 to 5 years, these are mainly seen in the changes in vasomotor symptoms, and like hot flushes, night sweats, palpitation, headaches, giddiness, paresthesia, and insomnia, and psychological symptoms like mood swings, irritability, depression, anxiety, poor memory, poor concentration, and loss of self esteem. And if the duration of menopause is between 5 to 10 years, the symptoms related to urogenital receptor, the deficiency of estrogen in these area like vaginal dryness causing dyspareunia, urethral burning, loss of libido, and in skin because of loss of collagen because of estrogen there is thinning of estrogen, wrinkling of the skin, there is delay in the wound healing, and long term in the bones there is no formation of new bone, as well as there is increased osteoclastic activity, that is bone reabsorption is also more. So ladies come up with fractures which with minimum effort, like the Colles fracture in the distal forearms, vertebral fracture leading to scoliosis, shortening of the height of, and a hump of the vertebra, vertebral compressions. Thank you.
Thank you, Dr. Soumya, for providing us with these hormonal changes and the associated disease with that. Moving ahead with the discussion to Dr. Ashish, can you please tell us, what common myths about menopause do you encounter so far, and how can we counter them with the accurate information?
Well, there are many myths in menopause. Usually, the lady come and says that I'm forgetting everything. I'm forgetting where I'm keeping things and things like that. The YHI study, there is a Women Health Initiative study, has shown that just by replacing it with the estrogen or HRT, it is not going to really, these functions really don't improve. So for it is a basically a aging problem of brain, and one is to be very active with the brain. And more active they are, this problem will be less. So they have to really exercise the brain, like solving crossword puzzles or playing chess, things like that. Now, the next, there are people who come with the thing that the menopause is a phase when it will start when the menstruation stops. But we know that there is a spectrum of changes in menopause, and actually, the signs and symptom and the changes starts well. It has been proved that by straw study, that or classification, that 7 years before the actual cessation of menstruation, the the signs, symptoms, and subtle changes of menopause starts. So it is not that the woman will take preventive measures when they actually cease menstruation, having a period. Not that beyond 40, I think one should go on, taking the usual, take counseling and taking the usual preventive measures for to counteract these menopause problems. Now, another myth is they can't get pregnant once the cycle get irregular. But this is another myth. We see patients, we see women who come pregnancy at the age of 45 women, and they thought that they had menopause, but after testing, we see that though it is rare, but it is possible. And so the woman has to provide it with oral contraceptive if there is no other contraindication at the last 1 year when they are having this irregular, or even before that when they are going through this irregular cycle. Another myth is that sex life is over because of the problem they have with the dryness of vagina and less libido and things like that. But with the treatment with vaginal lubricants and with replacement with estrogens, this can be overcome, and they can have a fruitful sexual life also. Now, weight gain is another. They feel that after menopause, weight gain is there. So this is another, aging, because at that age usually the activity is less, and they should adjust with the food habit and activity, and they should go into exercise like walking and other things if they're not doing that. So that weight gain has to be controlled, because there will be other problems along with weight gain. Many of the women feel that the menopause will occur at 40s, after 40 years, 40, 45 years. It's not that. Though rare, we have seen that there is something called a premature menopause, which occurs even before 40. And statistics shows that, before 40, usually the rate is 1%. Before 30, it is 0.01%. Even before 20, it can happen, and that is 0.001%. So it is not that it can't happen once the menopause, the menstruation has ceased. It can happen at any age, but usually, yes, the age is from 40 to 55 years. That is the age. And another myth is that yes, I will have it when my mother had. So this is, yes, genetically it has some bearing. It has been seen that with genetic, and there are predisposition of genetic factor at the age of onset of menopause. It is, to some extent, it is, yeah, true. It has been said. And another myth is that only severe menopausal problems like hot flush, and if that doesn't happen, then there is no need to. Even little bit of hot flush doesn't require any treatment. That is another myth. But I think, irrespective of if someone is having problem or not, it has been established by WHI study that yes, replacement therapy does good for women. Though there have been previously, around I think 2003, there has been a report where it was shown that there was uh, embolisms and other things with replacement. But later on, when the final report came up, there was correction in the statistics around 2013 when the report came that yes, it was definitely beneficial. There is a little bit of more chance, very negligible chance of having cancers, and of course we are going to screen that. There are contraindications of giving HRT in case of history of breast cancer problems in the family and all that. So that precautions are being taken. Otherwise, it's really beneficial to have HRT so far. Established knowledge of the day goes. Yes, sir.
Thank you, Dr. Ashish, for busting all those myths and providing us with the right information. Moving ahead with the discussion to Dr. Lilavati Guru, can you please tell us what practical strategies or lifestyle adjustment can women implement to effectively manage the menopausal symptoms?
Managing menopausal symptoms can be effectively achieved through a combination of lifestyle adjustment and practical strategies. A balanced diet rich in phytoestrogen, that is available from soya, flax seeds, and all those things. Calcium and vitamin D rich diet can help support hormone balance and bone health while staying hydrated. That means you have to eat a lot of you have to drink a lot of water and avoiding triggers like spicy foods or caffeine, alcohol, or refined sugar can reduce hot flashes. A regular exercise including weight bearing and aerobic activities promotes physical and emotional well-being. Practices like yoga, mindfulness, and meditations help manage stress and mood swings. Maintaining good sleep hygiene, that is, going to bed at the same time each every day. Um, and staying connected socially, reading books, watching movies, listening to music, or through support groups can also provide emotional relief. Women may also benefit from hormone replacement therapy or alternative remedies. Though these should be discussed with a healthcare provider. And regular health screening, such as bone density test and cardiovascular checkups, are important to monitor risk associated with menopause, while proper skin care alleviate dryness. These strategies collectively enhance overall health and quality of life during menopause. Thank you.
Thank you, Dr. Leelavati, for providing us with these recommendations and the advices. Moving ahead with the discussion to Dr. Beauty Banerjee, can you please explain how does menopause influence long-term health risks like osteoporosis and heart disease, and what preventive measures should women consider during this transition?
Long-term effect of menopause on human body is definitely the osteoporosis and the cardiovascular disease. The osteoporosis is a condition characterized by decreased bone mass and structural deterioration of the bone tissue, leading to increased bone fragility and fracture risk. The drop in estrogen during menopause plays a central role in accelerated bone loss and observed in postmenopausal women. Impact of estrogen, loss of bones. How bone remodeling imbalance. Estrogen regulates bone metabolism by balancing osteoclast and osteoblast activity. Its deficiency leads to increased osteoclast, that is, bone resorption activity, and decreased osteoblast, bone formation activity, resulting in net bone loss. That causes the osteoporosis. So, also calcium absorption. Estrogen enhances calcium absorption from the intestine. Post-menopause, the reduced calcium absorption exacerbates the bone loss. Also, the vertebral and hip fractures are most common and serious, often leading to decreased quality of life, increased morbidity, and mortality. Cardiovascular disease, CVD risk disease post-menopause due to changes in the cardiovascular system influenced by hormone levels. Estrogen, lipid metabolism. Estrogen helps maintain favorable lipid metabolites by raising high-density lipoprotein and lowering the low-density lipoprotein cholesterol. Postmenopausal women often experience increased LDL and decreased HDL. The vascular function, estrogen promotes vasodilatation and maintains the structural integrity of the blood vessel wall. Its deficiency leads to vascular stiffness and impaired endothelium dependent vasodilatation. So, the blood vessels get more stiffer, blood pressure rises, that is often, and it causes all the problems. What are the preventive measures? For osteoporosis, calcium and vitamin D intake, a woman over the 50 years should aim for 1200 milligram of calcium per day through dietary and the supplements. Vitamin D enhances calcium absorption. The recommended daily intake is 600 to 800 international unit per day and may be adjusted based on the blood levels and the sun exposure. Weight bearing and strength training exercises. Activities like walking, jogging, resistance training help maintain bone density by stimulating bone formation. Again comes the DEXA scan is recommended to assess bone health, typically at the onset of the menopause to establish a baseline and guide treatment decisions. Medication we all know, bisphosphonates. This drug slow bone resorption and can improve the bone density. And second is the selective estrogen receptor modulator, or we commonly known as SERMs, mimic the estrogen protective effect on bones without affecting the breast and the uterine tissue. Next comes the lifestyle modification. We should avoid smoking and alcohol consumption, both of which can increase the bone loss. Now, the cardiovascular disease. And for its prevention, the most important things is the healthy diet. Emphasize a diet rich in fruits, vegetables, whole grains, lean meat, and healthy fats like those found in fish and nuts. Limit saturated fat, white sugar, and salt to maintain healthy blood pressure and cholesterol level. Regular physical activity is another important thing. Aim at least 150 minutes of moderate intensity aerobics exercises per week. 150-minute moderate aerobic exercise per week alongside strength training exercises at least twice a week. Then comes the weight management. Maintaining a healthy weight helps control blood pressure and definitely reduce the cardiovascular disease risk. So regular health screening is also important. Monitor blood pressure, glucose, and lipid profile regularly. Uh, what are the medication you can have? We all know statins and other things. Avoid smoking, and then we can always go for either the hormone replacement therapy or if you are having these things more, the hot flushes and things, or some lubricants or vaginal gel for the dryness part. So we will have to weigh the risk and benefit and then advise HRT. Thank you.
Thank you, Dr. Beauty, for providing us with these insights. Moving ahead with the discussion to Dr. Soumya, can you please tell us what role can family and friends play in supporting a women during this transition, and what should they understand about this to help women?
Actually, this is a very complicated and challenging period for a woman because uh, is in a transition, hormonal transition, which is taking toll on her emotional health as well as physical health. So she needs a very strong support system in form of her family and friends. Although in India we don't have a, because there is very little awareness regarding this thing, so many women don't discuss their issues, physical issues and emotional issues with their friends and family, to be in fear of being getting misinterpreted. But in West, in European country, there are proper guidelines that how family and friends can help their women out in this situation. So first thing you have, because of there is increased depression and anxiety, fear of unknown, so the family friend and friend can help by giving them positive counseling, helping her socialize more, and then you can also help them to encourage to take part in different activities with other friends, so this can uplift the mood as well as increase the self esteem, and she can feel empowered, better empathy at workplace. And also you have to cut down, help the women to cut down on alcohol, quit smoking, which most of the women do under social pressure. And in friends can help them join a good gym, help them out with their aerobic exercise, or go with them for a walking, and motivate for strength training exercises, because in India it is seen as there is very myth regarding strength training exercises. I myself have seen many people, if I suggest them strength training exercise, they are like, no, it will cause damage to my joints, my bones. So people don't want to get engaged in a strength training exercise, and they are happy with walking only. But no, this should be encouraged in, especially in a postmenopausal lady, with adequate dietary supplementation of calcium, phytoestrogen, vitamin D, and good eating habits. And if there is any physical problem or emotional problem, they can reach to any healthcare provider or gynecologist to help her out. And definitely it will be better if we make a social support groups for these ladies, where they can connect, share their problem, and feel free and feel not feel ashamed that these problems are happening with them, especially in our society, Indian society.
Thank you, Dr. Soumya, for providing us with these insights with this positivity. Moving ahead with the discussion about the diagnosis and detection parts, I request Dr. Ashish to please tell us what are the most reliable methods for diagnosis menopause, and how do healthcare providers differentiate between the menopause and the perimenopause stage.
Uh, for diagnosis, I think when someone is around more than 45 years and the menstruation has ceased and there are symptoms like hot flushes and other vasomotor symptoms, one can say that the lady is into menopause. And if she's not already on HRT, that can be started and other advice can be given. Now the question is, if he's below 45, then of course one has to go for tests to find out that what is, and specifically the most reliable, I think, is the FSH level. Along with FSH, we also do the TSH level and other basic tests. Now, as we know that these FSH level, when it is more than 30, we can say that yes, it is. But in Western countries, the cutoff level they keep it as 40. But in for all practical purpose, at the level of 30, we can say that yes, menopause has been established. And regarding the menopause and because the menopause, as we have already discussed, that it is a retrospective diagnosis where there is more than 1 year of complete cessation of menstruation and a total stoppage of the ovarian follicle functions. But the perimenopause period, that is, we starts the staging has already shown that it starts 7 years before actual cessation of menstruation. So these perimenopausal period, the diagnosis, there will be a gradual change in, estradiol level will fall, and then gradually the FSH will rise. And often the lady, they come and say whether I am entering menopause or not. How far is menopause? So by doing that hormonal levels, we can guide them. We can say that yes, you are approaching maybe 1 year, 2 year, but it's very difficult to say exactly at what point they will have the complete cessation of menstruation.
Thank you, Dr. Ashish, for providing us with the insights onto that. Moving ahead with the discussion to Dr. Lilavati, can you please provide us information on what societal changes or policy would you like to advocate to enhance the menopause awareness and support in the community?
Enhance menopause awareness and support in community, several societal changes and policies could be advocated. First is public awareness campaign. In that, it includes educational program through mass media, community outreach, and health institutions to normalize conversation around menopause and reduce stigma. Menopause education in schools as a part of health and biology curricula, ensuring young people are informed early on. Collaborate with influencers to create digital content and use social media platform for a broader reach. And workplace support includes menopause friendly workplace where employers should offer flexible work hours, leave option, and a comfortable work environment that is temperature control for women experiencing menopause. Employee assistance programs include offering counseling and guidelines for women facing menopausal symptoms and training managers to recognize and support menopausal women, ensuring a stigma free and inclusive environment. Healthcare, third is the healthcare access and education. Specialized menopause clinics should be installed within primary health centers that provide easy access to experts like gynecologist and endocrinologist. Training for healthcare workers on menopause management so they can provide informed and empathetic care. Inclusion of menopause in routine healthcare discussion, similar to how pregnancy and postnatal care are handled. And community support group includes established local or virtual support groups where women can share experiences, receive emotional support, and exchange information. Encourage peer education program, especially in rural areas, to ensure menopause knowledge reaches even the most marginalized women. Research and policy advocacy. Fifth is research and policy advocacy, where push for government funding for menopause related research to better understand the specific needs of different groups. Advocate for insurance coverage of menopausal treatments like hormone replacement therapy and mental health support, ensuring affordability. And menopause in national sixth is menopause in national health policy in inclusion of menopause management guidelines in national health policy in ensuring standardized care protocols in both urban and rural areas. Consider making menopause care part of national health mission similar to maternal health with resources dedicated to awareness, prevention and treatment. By addressing menopause from a societal, workplace, and healthcare perspective, we can ensure that women receive the support they need during this crucial stage of life. Thank you.
Thank you, Dr. Lilavati, for such changes and for these recommendations. And I think these changes should be really incorporated in society to make a difference. Moving ahead with the discussion to the diagnosis and testing part, Dr. Beauty, I request you to please tell us, are there any imaging techniques that can aid in the evaluation of menopause related complications, and when are they necessary?
Okay, I will take that question. The evaluation of menopause related complication often necessitates the use of various imaging techniques, each serving a specific purpose depending on the clinical scenario. These imaging modalities help in identification and management of several conditions associated with menopause, such as bone density issues, cardiovascular changes, and certain gynecological concerns. In this comprehensive discussion, I will detail the imaging techniques relevant to the menopause, their indication, and when they become necessary in clinical practice. First and foremost, again, is the DEXA scan, that is a dual energy X-ray absorptiometry scan. The DEXA scan is the gold standard imaging techniques for assessing bone mineral density. Osteoporosis is a significant concern post-menopause, play a crucial role in maintaining the bone density. Indication and necessity recommended for all women 65 years and older or postmenopausal women under 65 with additional risk factor of fracture. That is low body weight, prior fractures, family history of osteoporosis. So what we can give, we can provide T score. What is a T score? T score helps in diagnosing osteoporosis. T score is a comparative score with a healthy young adult. So it's a negative scoring basically, and the more the closer, if the your score is closer to 0, it means it's a healthier bone, and if it is a more minus, it is more than minus 2.5, it is osteoporosis. In between minus 2.5 and minus 1, it is osteopenia. Right. Second comes the quantitative computed tomography or QCT. This is just like a CT scan, while less commonly used than DEXA due to the higher radiation exposure and cost. QCT provides three-dimensional measurement of BMD and is particularly useful in assessing trabecular bone loss, especially in the case when you need the detailed images of the vertebra. You have a prolapse, you have allisthesis or any other thing, you need a detailed thing of the vertebra. You should go for QCT in that thing. Here we can give, generally they give us a Z score. Z score is a comparative score with the same age and same ethnicity level, but a healthy one. So indication and necessity utilized when more details analysis is required or if a patient cannot undergo a standard DEXA. It helps in cases when detailed vertebral evaluation is necessary or when DEXA is non-conclusive. In few cases, it is not conclusive, DEXA is not. Then comes the coronary artery calcium scoring via the CT. We see if there is deposit of calcium in the coronary artery, and there is again a scoring for that. 0 to 10 is very good, you have no problem. Then the moderate is up to 0 to 300, where you should go for statin, or after 300 to 400 you should go for an angiography. And if your score is CAC scoring is more than 400, you should definitely go for angiography, and you should take the cardiologist uh, appointment. So where it is recommended, CAG scoring is recommended for postmenopausal women with immediate risk of cardiovascular disease to further assess risk and guide in the intensity of preventive measures. Then comes the echocardiography. Before echocardiography, you can always go for a simple blood pressure test, a pulse, a blood pressure test, and then the ECG. This is non-invasive ultrasound. Echo is a non-invasive ultrasound, provides real-time imaging of the heart, assessing cardiac function and the structure, which can be affected by long-term hypertension and other cardiovascular risk associated with menopause. Necessary when clinical evaluation or other diagnostic tests, including a ECG, has some abnormalities. Usefulness for assessing left ventricular function, valvular heart disease, and hypertension related heart changes, which may be more prevalent after menopause. And for all this, we should go for an echo. Then comes the pelvic ultrasound. Pelvic ultrasound involving both transabdominal and transvaginal aids in evaluating various postmenopausal gynecological issues such as abnormal uterine bleeding and ovarian mass assessment. Again, indication is same in postmenopausal bleeding or any suspicion of carcinoma. When we will go for an MRI, of course, it is not a routine test. And when the USG is non-conclusive, and when we want to do a more detailed test, we want to plan surgeries, then we should go for an MRI. Other thing, the breast health, mammography. Regular screening plays a critical role in early detection of breast cancer, which remains a significant risk for women post-menopause. When it is recommended, every 1 to 2 years for women aged 50 to 74, while earlier screening advised for those with higher risk factors. Essential for detecting early signs of breast tissue changes that indicate cancer. And if mammography is non conclusive, again we will go for breast MRI. Breast MRI is a supplementary tool used in the conjunction with mammography for certain high risk population. Indicated in the high risk postmenopausal women, particularly those with a strong family history, positive BRCA, or useful in evaluating ambiguous mammographic finding or when we are planning surgery. That's it. Thank you.
Thank you, Dr. Beauty, for providing us with these insights onto that. In the end, to conclude, if we talk about the treatment and the management part, I request Dr. Soumya to please tell us how essential it is to tailor treatment plan for menopause symptoms to reflect individual experiences and the health backgrounds.
Actually, because the in postmenopausal women, the symptom is different and it differs from different women to women, as well as because of the age there are different comorbidities to them, like diabetes, chronic hypertension, coronary heart disease, and orthopedic condition like osteoarthritis and fractures. So this makes tailor-made treatment strategy for women very essential, and depending on like what kind of problem, everyone has discussed about the vasomotor symptoms, their treatment. But as a gynecologist, the orthopedic condition, fracture, how to diagnose and treat. But as a gynecologist, I would like to emphasize on the basic things like the loss of libido, dyspareunia, vaginal dryness leading to recurrent UTIs. For these, topical estrogen creams are very handy and helpful, and everyone has, we have mentioned regarding different strength training exercises for, but for these group of women who present to us with urethral problems like urinary incontinences and pelvic organ prolapse like vaginal prolapse, uterovaginal prolapse, there is very in uh, the Kegel exercises or pelvic floor exercises to strain the pelvic floor muscles, which also sag because of loss of collagen and protein due to deficiency of estrogen. So these should be advocated. Women should be counseled regarding the different symptoms and how to take care regarding the general dietary habits and exercises, lifestyle changes, what everyone has mentioned. So these Kegel exercises, and depending on what how severe this is, we can go for treatments like bladder training, where we ask the women to hold the bladder and increase the interval between voiding. And there are also few treatments which are not operative, like neuromodulatory, where nerves of the bladder and the pelvic floor muscle are stimulated to strengthen the muscle. Also for incontinence, we can go for newer molecules that are injected around the urethra that take part of the incontinence by decreasing the size of the bladder opening. And increase of there is also use of buttocks for these kind of patients who have incontinence, where there is a spasm of the bladder muscle to relax it, so there is decrease in urge incontinence. Also we can go for surgery if there is required, and sling surgeries in cases of incontinences, and with synthetic material or using body's own tissue. For prolapse also, there is there are different kinds of operation, like few operation which restore the pelvic floor supports, or we can get rid of the pelvic organs like uterus by just the simple hysterectomy, depending on the different routes. And these are the urogenital. As a gynecologist, most of the patients we cater to or come to our clinic with these postmenopausal symptoms like irregular or absent period and these symptoms, because because of less awareness, vasomotor symptom and psychological problem, they are these problems are mostly missed out. So if they have this cognitive problem, depression, anxiety, first we should help them with cognitive behavior therapy. If it's not working, serotonin, like different medicines like serotonin receptor uptake inhibit SSRIs and clonidine, these can be used. And so tailor made, and we have to also take part of the other comorbidities like after 65 coronary vascular disease or osteoporosis leading to fracture. So as and when how the patient come to the healthcare provider, we have to first take care of the primary presentation that has compelled her to reach to us. We have to treat that, and apart from that, the general things we can help women to mm, take in consideration and changes she have to take in her lifestyle. So this part of her life after her reproductive age is over and she is now in old age, she can have a good, healthy, happy, satisfied life.
Thank you, Dr. Soumya, for explaining this very wonderfully and for this insightful information. As we conclude our session on Midlife
I would
Reimagined,
just
please.
add one more thing, because yeah, because I am a fertility specialist, I'm an IVF center. uh, as a fertility specialist, they are the age, for postmenopausal women, the scenario is not same what used to be 10 or 15 years back. These women, because more are working, they are more empowered, more financially independent, they have their voice now. Many women who have delayed their reproduction, means childbearing, because of their career or studies, now they present late to us for having babies. So what I want to add is, just because you are a menopause or you have hit menopause because of the age or because of surgery or conditions like endometriosis, repeated surgery after endometriosis, or after a cancer survivor, after removal of her ovaries, after her like cancer treatment or cervix. I'm dealing more in onco fertility expert who deals in cancer survivor patients. So we have, like, we give hope to them also. We help them through ART procedures like IVFs, cryopreservation of embryos, egg preservation if they have not married, they don't have spouses. Even in those conditions, they can, or even they can have a social freezing where at 35 they know they are not going to get pregnant before their 40s, and at that time the menopause is also entering their life, so they are confused. So we have this special, like group of girls who are approaching us. I said now more empowered ones who take care of their lives and want to control their lives. So we have these options available for them as a fertility specialist as well. So I want to use this platform of voice of healthcare to create awareness regarding these things, so that with the advancement of technologies in fertility sector like assisted reproduction, we have with better success rate, we are providing or helping even the postmenopausal women with problem of having like childbearing.
Well, Dr. Soumya, that's really enlightening to know about such techniques and advancements when it comes to the women health. As we conclude our session on Midlife Reimagined, a 360 approach to wellness and renewal, we have gained crucial insights into menopause, its signs, symptoms, and implications, while debunking some of the myths that often perpetuate the stigma. And it's clear that increased awareness and the open dialogue are essential for empowering women during this transition. So let's take this knowledge we have shared today and turn it into the action to advocate for better healthcare resources and support one another. And in the end, I would like to extend my gratitude to all the panelists for your insightful contribution and for sharing your expertise with us today. Your participation has been really valuable, and we deeply appreciate the time and knowledge that you have shared. Thank you for joining us and for contributing this important conversation. Thank you.
Thank you, Sumedha.
Thank you.
Thank you for giving us this
And good
platform
night to
to
everybody.
help these like group of women who feel shy to help to reach their healthcare provider.
Thank you, Dr. Soumya. Thank you, everybody.
Thank you.